We're back with a topic that's not often talked about, but affects countless lives across the country. September is National Suicide Prevention Month, a time meant to shine a light on a growing problem. Did you know one person dies from suicide every 11 minutes in the U.S.? And that number has generally been on the rise over the past few decades. It is an issue here at home. Look at this. The latest CDC figures show more than 19 people per 100,000 died by suicide in 2023 in Kansas and 18 in Missouri, both well above the national average. Men, people older than 85 years old, and members of the LGBTQ community are especially at risk, not to mention another important group that's often overlooked.
If you talk to a veteran and I say 22, strong chance that they're going to understand what you're saying.
Military veterans are dying at an alarming rate. The VA once reported 22 veterans die every day by suicide in the U.S. And though the numbers are trending downward in recent years, it's still very much a problem. Missouri is working to curb those numbers and save lives. Last year, lawmakers passed a measure requiring the Missouri Veterans Commission to come up with solutions to bring down the veteran suicide rate. The commission released a report this summer showing veteran suicides at more than twice the national average and the rest of suicide deaths in Missouri. The Kansas City Metro ranked third statewide. The report also makes note of what needs to be done to help solve this problem. Let's get to the heart of the matter with Lindsay Ward, Suicide Prevention Manager for the Missouri Veterans Commission. Thank you so much for being here to shine a light on this important topic. First off, why do we see such higher rates of suicide in veterans?
Well, certainly they have things that they experience throughout their military career that can contribute to increased likelihood of mental health issues. Sometimes they find a lack of supports when they are trying to re-enter back into civilian life, and they find that there are many challenges that they face. There is a stigma attached to help seeking, so oftentimes when they need the help, they are resistant to it because it is kind of a sign of weakness, which kind of goes against what we as veterans have learned during our military service.
Right, that reluctance to get help, worried that it somehow is a matter of pride when really people are there to talk to people in need. What else did this report find?
We found that there are some blind spots to data due to the timeliness of the reporting. So most of the data that we were able to draw upon to try to identify the landscape of veteran suicide for our state is traditionally 2 years behind. So again, that does kind of create blind spots as to where are our problem areas and where can we target efforts to help reduce veteran suicides. So timelier reporting would certainly be more helpful so that we can understand where we can target specific assistance and help our veterans in reducing suicide numbers.
Right. The whole goal here is to find solutions and, as you said, save lives. Aside from that, what else can we do? What else can Missouri do?
Certainly promoting 988 is very beneficial. We are very fortunate to have access to 988 in the state of Missouri. Veterans can contact 988 and push number 1, either via talk, chat, text, and there are crisis counselors available 24/7 for confidential help. Missouri Veterans Commission also has a web page. They are there and ready to help put veterans in contact with resources to help them through whatever they're going through.
You know, this report is just part of the state's efforts to help veterans in need. You also have a specific veteran suicide prevention program. What does that entail?
So far, what that has entailed is, again, identifying what the landscape looks like with veteran suicide in the state. So resourcing, networking through other agencies in the state to see what programs are currently in existence, and also just trying to identify where our problem areas are. So far, that has pretty much just presented that issue with, like I said, the data delays. We are just continuing to move forward in trying to pinpoint where we can target efforts to helping veterans in reducing suicide.
We appreciate everything you're doing. Lindsay Ward with the Missouri Veterans Commission, thank you for your time and the work you're doing to save lives. Again, as Lindsay said, please know help is out there. If you need someone to talk to, you can always call or text the National Suicide and Crisis Lifeline at 988. Operators are standing by 24 hours a day. We'll be right back.